Picture this, a hospital meant to heal the wounded, transformed into a scene of brutal slaughter where hundreds of innocents lose their lives in cold blood. That's the gut-wrenching tragedy reported from El-Fasher in Sudan, and it's shaking the world right now. In a shocking turn of events, the head of the World Health Organization, WHO, Tedros Adhanom Ghebreyesus, has publicly condemned the Rapid Support Forces, RSF, a powerful militia in Sudan, for what he describes as appalling atrocities. According to the UN Health Agency, RSF fighters are accused of massacring around 460 civilians inside the main hospital in El-Fasher, a city in the Darfur region. This horrific incident occurred just days after the RSF seized control of the city, following an arduous 18-month siege that subjected residents to starvation, relentless bombardment, and utter despair. For beginners unfamiliar with the conflict, the RSF is a paramilitary group that was once allied with Sudan's regular army, but has since become a major player in the country's civil war, which erupted in April 2023 over disagreements on transitioning to civilian rule. The Sudan Doctors Network, a group of medical professionals on the ground, painted an even darker picture. They reported that on Tuesday, RSF militants cold-bloodedly killed everyone they found inside the Saudi hospital, including patients, their companions, and anyone else present. While they didn't provide exact casualty numbers for this specific attack, they described the hospital as having been turned into a human slaughterhouse, highlighting the ruthless disregard for human life in places of healing. Adding to the outrage, the network accused the RSF of abducting 6 healthcare workers, 4 doctors, a pharmacist, and a nurse, and demanding exorbitant ransoms exceeding $150,000, about £114,000 for their freedom. This not only endangers lives, but also undermines the very foundation of medical neutrality in conflict zones. Local activists from the El-Fasher Resistance Committee echoed these grim accounts, noting a horrifying silence that descended after the attack, as if the world had momentarily paused in disbelief. El-Fasher had long been the last bastion of the Sudanese army in Darfur, a vast region scarred by historical ethnic tensions. Its fall has effectively divided Sudan, with the RSF now dominating most of Darfur and parts of neighboring Kordofan, while the army clings to the capital, Khartoum, and areas along the Red Sea coast. To put this in perspective, imagine a country split like a fractured vase, where power struggles leave ordinary people caught in the crossfire. Much like how the RSF and the army, former coup partners in 2021, turned against each other amid international efforts to foster democracy. But here's where it gets controversial. Allegations abound that the RSF and allied Arab militias have deliberately targeted individuals from non-Arab ethnic groups in Darfur, claims the RSF vehemently denies. Since the war began, these accusations have fueled debates about ethnic cleansing, reminiscent of past atrocities in the region. For those new to this, Darfur's conflicts often revolve around deep-rooted divisions, and such targeting could escalate an already dire humanitarian crisis. With El-Fasher's capture, the United Nations, activists, and aid organizations are deeply worried about the fate of an estimated 250,000 people trapped inside the city, many from these vulnerable non-Arab communities. A communications blackout has shrouded the true extent of the unfolding disaster, making verification painstakingly difficult. Adding to the horror, BBC Verify has examined newly surfaced videos on social media depicting RSF fighters executing unarmed individuals in recent days. These clips offer a chilling glimpse into the violence, though confirming their authenticity remains challenging amid the chaos. Aid workers report that the full scope of destruction in and around El-Fasher is only now becoming clear as survivors brave perilous journeys to safety. One such account came from a man who fled to Tawila, about 60 kilometers, 37 miles west of El-Fasher, describing the intense shelling on Saturday that forced their escape. Speaking to BBC Arabic's Sudan Lifeline program, he recounted how RSF militants filmed them, subjected them to beatings and insults, stole their belongings, and demanded ransoms for captives, some of whom were later executed. The ordeal included widespread arrests, severe hunger, and dehydration, painting a picture of unrelenting suffering. Jan Egeland, a seasoned former top UN humanitarian official, described the situation as catastrophic in an interview with the BBC. "We have had massacres on top of all those months of deprivation, starvation, no medical care," he lamented. "I think this is the worst place on earth now. It's the biggest humanitarian emergency on earth, and it happens in the dark, really. There has been far too little attention to what's happening in Sudan." Dr. Tedros reinforced this by noting that prior to the Saudi hospital incident, the WHO had documented 185 attacks on healthcare facilities since the war's outset, claiming 1,204 lives. He urgently called for an immediate and unconditional halt to all assaults on health services, emphasizing protection under international humanitarian law. "All patients, health personnel, and health facilities must be protected. Ceasefire," he pleaded. And this is the part most people miss. Despite these cries for help, the world spotlight has been dim, raising questions about why Sudan's agony hasn't sparked global outrage akin to other conflicts. Is it because the media's focus is elsewhere, or is there a deeper geopolitical indifference? Some argue that stronger international intervention, like sanctions or peacekeeping forces, could prevent further atrocities. But others counter that external meddling might complicate Sudan's internal power struggles. What do you think? Should the international community intervene more forcefully in Sudan's war, or risk letting these atrocities continue unchecked? Share your thoughts in the comments. Do you agree that this is the planet's most overlooked humanitarian disaster, or is there a counterpoint I'm missing? Let's discuss how we can bring more attention to these forgotten voices.